Welcome to the new Cyber Frontier, bringing you the latest news and initiatives that focus on the development of cybersecurity economics. You don't have to be a computer or cybersecurity expert to get plugged in. Your host brings it straightforward, asks the tough questions, and brings the cyber world to a level of understanding for everyone. You can find us on the web at www.newcyberfrontier.com. Now join our host as he introduces the topic for today's new Cyber Frontier.
Welcome to today's episode of New Cyber Frontier. You're on today with Christopher Gorog here, and we also have a guest on. This is a special IEEE blockchain series we have for blockchain for AI and healthcare, looking at different verticals in some of these emerging technologies that are related to cybersecurity. On today, Pritesh Sethi, who is a MBBS, a PhD, and associate professor of computational biology, the head for the Center of Excellence in Healthcare at III Delhi, and I can say the name of that university. Maybe we'll let him do that. But also a fellow of Wellcome Trust, BBT India Alliance, and sometimes a visiting professor at Stanford, I hear. So, Pritesh, welcome. Thanks for joining today.
Thank you, Christopher. My delight to be here.
Definitely. So, we want to let you kind of give your background, how you got to where you're at. But this is exciting today. Some of the things that I've heard he does. And we'll talk about for the future of what blockchain use and security by design, kind of when we look at that and the trust and stuff for using blockchain for healthcare. So Trev, give us kind of your background on yourself. How do you got where you're at?
Sure. So I grew up in a small town up north in India called Amritsar. And I did my medical training from Government Medical College, Amritsar. And while I was finishing up, essentially I got this idea that essentially we should be using more data and modeling for taking decisions in critical situations such as the ICU scenarios. And that's where my journey started into the data aspects of healthcare. And I did a PhD in computational biology, which was focused a lot on physiological aspects and unraveling some of these physiological systems using data. I was awarded an MIT TR35 Innovators Under 35 India Award for capturing small airway disease using models at a very early stage. And since then, I essentially have been developing models, technologies, approaches to address challenges in various healthcare settings, working alongside hospitals and more recently with public health organizations. And so after completing my PhD, I was working with the All India Institute of Medical Sciences, AIIMS, New Delhi, in the Department of Pediatrics, in the ICUs, where the question we were asking was, how can we detect which children, which babies are likely to crash with critical outcomes like shock and sepsis in the next 24 hours and so. And that led to one thing led to another. And we started working with these models in a more sort of decentralized, large scale settings where we combined various different data sources together to build models that can be generalizable to a variety of different settings. And essentially, this also led us to a natural segue into public health, because a lot of what happens inside the ICU actually is governed by what happens at home, especially in Indian settings and in developing settings where a lot of infections, for example, readmissions happen because of hygiene conditions at home or measures that can be taken at home. So that led us to develop models and methods to address some of these public health challenges around sepsis, and from there on to COVID-19. And that was a project which we call the WASH Karo project. It was the first AI ML-based application for raising WASH awareness during the COVID-19 times, during the pandemic. When I was at Stanford, I was involved in building models which are more equitable, lead to more essentially tackling the health inequalities. And that's another area that that is close to my heart, because I work with these diverse settings, especially across um, uh, sections of the society in India and so
Yeah.
on. So more recently, we've been working on COVID-19 pandemic, and models that can help us address it in a more all-round fashion using data sets which we call non-traditional data sets.
Interesting. Well, let's take a break here from our sponsors. We'll be right back in a couple minutes.
Blockframe technology offers next-generation blockchain managed trust and security. Unique non-fungible tokens are used to secure software bills of materials to provide data quality and security for every transaction in your supply chain. Deploy advanced peer-to-peer product security, scale zero trust capability to millions of IoT devices, allow vendor tracking and accountability, and rapidly reset from compromise. Unchangeable, time-sequenced blockchain data provides next-generation security using machine learning trust algorithms and audit analytics. Start securing your supply chain today by contacting Blockframe at www.blockframetech.com.
Welcome back to New Cyber Frontier. On today with Trev Pitesh Sethi, who is calling in from India here. So before the break, you had talked about your background and your passions, and I could hear them bubbling through on healthcare, medical, and the children you talked about, and identifying risks. So this must come from something stemmed from your childhood or something. What is it that has kind of bubbled that through?
Certainly, I think when I was finishing medical school, I realized that ever since my childhood days, science was something that was the most interesting and exciting and intriguing part of it. As you get into medical school, essentially it becomes more algorithmic, and the routine takes over. And that point of time, I was asking myself, how do I actually plug back into the knowledge discovery and the scientific discovery aspect in medicine using data and mathematics? That's something that I love, connecting both medicine and mathematics together. And that point of time, I think I realized that my career and my passion need to come together in a way which is fulfilling. And I think that's something that led to taking up data science for healthcare as a career option. And I would say, I've been just lucky enough to create a path which has not been a commonly available path, at least in the Indian settings, because we don't have a lot of opportunities as of now. Now they are coming up, but when I graduated, this was somewhat unconventional. But I'm glad that I took it.
Yeah. So do you like teaching more or researching new tech, or what do you like to do there at the university?
I think both are very much interconnected. I like cutting edge state of the art research, but then also connecting it back to what I teach in the university and courses that I develop. So essentially bringing back some of our learnings from the research to get people excited about the topics. I think these are super exciting topics, and I think teaching can benefit from the exciting developments that are happening in research. So I would say it's both 50-50.
Yeah, interesting. So in when we look at this is New Cyber Frontier, so we look at the connection of what is happening with data, with the security of it, with the looking at the privacy aspects, but applying blockchain and artificial intelligence are so wrapped into those features, and looking at future technology as well. How can we start designing in these tools that enable security, privacy as we start to use data? And I really like that we can kind of have these discussions about where that's going in a particular industry. So tell us about that research in the integration of blockchain AI to healthcare, and how that connection's made moving forward, and where you can point out how that touches that privacy security link.
Absolutely. No, so I think that blockchain is underutilized in healthcare applications, and so is artificial intelligence. I think the progression has naturally been data to models And when we see the results of the models come up, essentially, then we bring in these approaches that make use of privacy preserving technologies to disseminate our models and data in a more secure, private, auditable fashion. So I think that not a lot has yet transpired in healthcare, although there's a lot of research that has happened. But in the real world deployment settings, blockchain is going to be more and more important. And I think COVID-19 pandemic has made us realize that in a big manner. Just because think about it, contact tracing. So starting from there and building in AI models that can help better contact tracing, but now in a more privacy preserved fashion. From there on, think about sharing of medical data in a way that decentralized learning can happen about patients. Let's just talk about COVID-19 as an example, and what challenges that puts up. So, as we all know, that the medical data are the most sensitive data, but the pandemic has provoked the need for data sharing and greater understanding. And the only way to enable that is to actually bring in these technologies where decentralized learning can happen without data moving from one place to another, or representing data sets in a way using blockchain or other privacy preserving and enhancing technologies that, for example, the weights of the models can be shared in a decentralized manner without the data sets moving. And that has brought up a whole lot of federated learning discussion and the need for it going forward in healthcare. But it doesn't stop at the electronic health records and data sharing. Vaccines and passports and audit. So clinical trials, if we think about how clinical trials have happened and testing of different drugs and vaccines, how do we actually create more auditable systems? So wherever there is privacy, the need for audit, the need for sharing data, I think that's where blockchain comes in. Finally, I think you can also think about blockchain's role in healthcare from a more supply chain perspective, where you want to monitor, for example, the healthcare equipment or even vaccines as they are distributed in these networks. So those are the overarching themes that have come up in healthcare, which allow this granularity of access to be provided to various stakeholders, and then various levels of audit that can be put in, and AI models that are more privacy enhancing, and yet allow learning to happen in a distributed fashion. So those are a lot of words, but I think that's something that I believe the world will be moving in this direction more and more, and it's just been spurred more through this pandemic.
Yeah. So we want to. We hear a lot of how blockchain can open up, make data, make everybody be able to share it, but there's a balance there with now making everything available. And how do you foresee the balance of maintaining that privacy with the availability of data that we're saying that might be private to that person as healthcare data? How do we make that balance work?
That's a very important question. I think the purpose for which the data needs to be used needs to be really clearly identified and adhered to. So, not all applications in AI will require the granularity of data at an individual level. So, the balance lies at the clear identification of purpose and the corresponding level of access that can be granted through these technologies. So we're not saying that everything becomes available to everyone at the same level of granularity. It will need to be provided at the level at which the data needs to be purposeful. I mean, it has to be purposeful use of the data. Secondly, I think the consent management frameworks need to be extremely important in all of this. So, and that requires a lot of education of the individuals, of people, and what data access can enable for various organizations, and having these consent frameworks in place when we put together these blockchain-based technologies. So again, looping back to the point that not every application or not every organization needs to have the granularity of access at an individual level. If it needs to be, therefore, so then other frameworks like purpose and concept need to kick in, and I think that's something that can be very much regulated through the application of these technologies as well.
Okay. Let's come back in a minute after we hear from our sponsor. We'll be right back to finish that thought.
Blockframe technology offers next-generation blockchain-managed trust and security. Unique non-fungible tokens are used to secure software bills of materials to provide data quality and security for every transaction in your supply chain. Deploy advanced peer-to-peer product security, scale zero trust capability to millions of IoT devices, allow vendor tracking and accountability, and rapidly reset from compromise. Unchangeable, time-sequenced blockchain data provides next-generation security using machine learning trust algorithms and audit analytics. Start securing your supply chain today by contacting Blockframe at www.blockframetech.com.
Welcome back to New Cyber Frontier. On today with Tev, Pritesh, Sethi, and we're talking about blockchain use and security and privacy application of that in healthcare. And before the break, you talked about predicting critical outcomes and using that data and then balancing the privacy of what users' data or personal information. Give us an explanation of what that predictive data is needed and how that is separate from the data that would be private to the individual.
So this was about the intensive care unit setting where we were building models that can predict critical outcomes in the children and babies who get admitted to the ICUs. And we started out with building these models only for the pediatric settings. And the data are usually, ICUs are data-rich environments, but the data are routinely generated, but are also routinely lost. So it depending upon the size of the ICU, it may be anywhere between 1 gigabyte to 5 gigabytes of data per day, which are routinely lost. So essentially what we were building in the ICU settings were these frameworks which would allow secure data collection and then building of predictive models on top of these, which look at minute-to-minute changes in parameters of physiology, such as heart rates, pulse rates, oxygen saturation, respiratory rate, combined with other laboratory investigations, and what the treatment charts or clinical notes were entered by the clinician. So you can see that this is a lot of individual level data that is needed to build the kind of models which can then predict individual level outcomes. So and we started from there. We had success with models that can predict outcomes like shock, which is a hemodynamic condition, a mismatch between oxygen supply and demand. Organs start failing up to 24 hours ahead of time. But then we started realizing the importance of generalizing these models outside of this one particular setting. And that's when privacy-preserving technologies and privacy-enhancing technologies become important, because when you talk about generalization, you are talking beyond a given setting and beyond a given regulatory framework that we were used to working in, and then spread out across 200 different ICUs across the globe and potentially across India as well going forward. And that's where essentially we realize that these individual level data need to be secured using these frameworks. So I must confess, we have just started this work in building secure and privacy enhancing frameworks for the outcome settings, but we have been focusing more on the AI modeling side of things, where we build these deep neural networks based model that predict outcomes. But at the same point of time now, we are more cognizant of the fact that if we need to deploy these models in real world settings, because what we have been currently working is with our own setting and 200 other ICUs whose data are publicly available. But now if these have to be deployed in live settings across different ICUs, we have to make them privacy enhancing so that none of these data are compromised at any point of time from these new sites. So that's what we are currently working towards. And as I said, these are pretty early days for this kind of work.
Yeah.
That's what I'm excited about going forward.
So how would that look like? So information about, lab tests, lab results, temperature profiles, oxygen levels, heart rate, respiratory might be available for doctors to look at from every patient, but just not the information about who they are. Is that kind of the separation you're thinking about?
At a very crude level, yes. So I think again that boils down to governance and the role-based access. So within us, so if we talk about an institution, within the institution also there are these departmental access and roles that within department that every doctor can play. So what we are saying is that for my ICU or for the ICU that I'm in charge or for my residents, they should have access to all of this data. But if I need to exchange this data with any other hospital, there has to be a two-level authentication. Number one, the patient has to give the consent and that again depends upon the purpose for which this data gets exchanged. And that's something that we have been exploring in the Indian settings and using the National Digital Health Mission or the NDHM frameworks, which allows this consent management framework to be built in. That's a recent national mission launched by India. So we say that the patient has to give consent, and then, of course, the hospitals agree to exchange data for that level of granularity and purpose that they need. And that's when a doctor from another hospital may be able to see the data for a patient from another hospital, his vitals, parameters, and so on, and then take decisions or build models. So this collaboration can be enhanced through these frameworks, which, for example, the NDHM framework and the blockchain framework. So that's how we see that it's going to look like going forward.
Yeah. So how do you apply that decentralized concept that blockchain provides in that framework? How do you see that going, into application? And have you done any, demonstrations on that or prototypes?
So we've been working on a project which is supported by the principal scientific advisor to the Prime Minister's office, and that project was on how do we create a federated health platform for data exchange for COVID, because that was an emergency. So while doing that, yes, we have created a platform and demo applications within that, which demonstrate the use of the National Digital Health Mission artifacts, which make use of this NDHM sandbox, where a lot of these frameworks kick in, the consent manager frameworks for data exchange for patient, and also the frameworks for reports, diagnostic reports, laboratory investigations, prescriptions, and all of these. So far, the NDHM sandbox, basically, I think going forward, it will be incorporating the blockchain aspects as well. But we are very much plugged into this national digital health framework for enabling a lot of this. And within that demo platform, we also have showcased some of the applications that can be built using artificial intelligence. One of these was how do we combine different data sources and merge different data sources together to build predictions at different levels of resolution. So one of these was prediction of strain-based, variants-based information and what variants are coming up. How can we anticipate the rise? How can we anticipate the surges in COVID cases, especially now, for example, given the Omicron variant and earlier the Delta variant? So the genomic data sets are extremely sensitive. These are genome sequences they have a lot of information about people. Currently what is happening is countries around the world, governments around the world have come together and created this consortium, and they have been supporting the initiatives such as the GISAID, which hosts these anonymized, pseudonymized genome sequence information about people. But going forward, if we want to actually tie these genome sequence information to the clinical information together, we need such kind of privacy preserving technologies. So that's what basically we have been working towards. So our platform includes AI-based solutions for surge prediction using genome sequencing data sets which are extremely sensitive. And that's where I think going forward, the future will look at these technologies more and more and triangulate insights, but not triangulate data sets. I think that's what we are moving towards.
Mhm. Yeah, so that's kind of a stream prediction, I think is what you were calling that earlier.
Yeah, so
Where
it's called this. Yeah, we call it the strain flow model. It uses natural language processing. The key idea being the sequence of a virus can be read like a book, just as we know that now models can learn from textual data, and within viral sequences, these words or codons. Um, uh, they have some patterns and co-occurrence to form sentences. So, in other words, to form proteins. And how the mutations have happened in the COVID-19 spike region genome can actually be understood in a completely de novo fashion by applying these sequence level natural language processing models. That's what we did. And essentially, then we looked at the underlying patterns within these sequences, which can be predictive of next 2 months of caseloads in 18 different countries. So our strain flow models essentially look at these patterns and then predict how may the case surges evolve in the coming months for a given country, given the genomic sequence information available from these countries.
Mhm. So do you think, like in the United States we have HIPAA? I imagine there's some kind of a compliance you have to follow in India at least. Do you see that moving towards with these technologies towards a level where there's more control over the individual for their record, or it's more widespread and more governments controlled for the information of many people? Where is it
So at
heading in
least
direction?
Yeah, no, very important question. So I think the National Digital Health Missions frameworks at the heart of it is the consent manager framework. So the art within those artifacts, the patient is the controller of their data. I mean, in the Indian settings, it is moving more and more towards the patient being, or the person or the individual being the controller of their data, so of their health data. So I certainly see that as moving more towards giving more rights and control to the individual for sharing the data. But the challenge there is that is everybody aware of what can happen with the data? I mean, so many times we click on many terms and conditions, and we just say I agree, and especially the ways in which healthcare data sets can be used by various agencies. So I think a parallel effort probably will need to start where education of people around what that means
Mhm.
uh, for their own healthcare data exchange, and it'll bring in a lot of services to be enabled. For example, India is a country where there is a strong primary healthcare system that needs to be strengthened going forward more and more. So how do we bring in the closing of the loop from primary to secondary to tertiary level of access? Think about vaccination. India has a very strong vaccination history and programs in place, but now how do we tie it up at various different levels of services? So it brings in a lot of services and opportunities to strengthen the system, but at the same time, our people may not be at the same level of understanding about what can happen with data. And that is where I see that governments, for example, will need to play a bigger role um, in raising awareness, and agencies that can play a bigger role in raising awareness, so that it just is not a consent that I click on, but also be aware of what I'm consenting to.
Yeah. right. So kind of in closing here, is there anything that you need support with or would like to get out to our listener base that they can circle back around to things you're involved with or efforts that you need support on?
Absolutely. No, please feel free to connect with me offline if you want to go into more details of some of our work that we have been doing, especially in the AI for public health and ICU. That's the most exciting part of it. I would also love to connect with some of our listeners and see what are their challenges that they are facing, and if I can help address or help understand some of those challenges and provide more insights from what we have been doing in our work. I'm sure this was a very compressed interaction, so lots of insights that we can share and discuss about and help your work going forward.
All right. Well, thank you very much for joining today, and we definitely had a great show, and I well, kind of in closing here, just want to let you know that we'll put links to Trev Pratesh on the write up for the show, and definitely reach out to him, and also New Cyber Frontier if you need any connections there. Thanks again. You heard it here on New Cyber Frontier.
We hope you have enjoyed this episode of New Cyber Frontier. Remember to get involved. Often we think that someone else will handle privacy and security in the virtual world, but you are the only one truly in command of your virtual fate. Join our mailing list so we can keep you informed of breaking news and new releases. If you have an idea, if you have a question that you would like to hear answered, or if you want to get involved with our efforts, reach out to us at newcyberfrontier.com. We also encourage you to visit our sponsors' links, as they are the ones that really make this show possible. I want to thank each of you for supporting the show, and we look forward to seeing you back for the next episode of New Cyber Frontier.